Simple steps today for a stronger, safer, and more independent. What if I told you that the agonizing burning sensation, the continuous prickling pins and needles, or that distressing total numbness creeping through your feet and lower legs isn't just an unchangeable consequence of aging, sugar imbalances, or permanent nerve death? Instead, what if the real physiological culprit is a quiet, mechanical compression happening deep inside your lower back and hip joints while you are doing something as completely ordinary as sitting in your favorite living room chair, watching the evening news, or riding in a car? Most older adults facing the daily torment of peripheral neuropathy believe that their only options are to rely on increasingly heavy doses of prescription nerve-numbing medications, rub on temporary topical creams, or simply watch their mobility slip away year after year. They look down at their feet and assume the damage is entirely localized, that because the tingling is in the toes, the root problem must reside exclusively in the toes. But modern clinical research in geriatric neurology and restorative medicine reveals a vastly more empowering story. Many cases of chronic senior leg numbness are heavily amplified by what we call silent structural trapping. When you sit unmoving for hours, the pathways through which your lower nerves travel become severely restricted, reducing vital oxygenated blood supply to your peripheral nerve endings and making your neuropathy symptoms flare up with absolute intensity. Today, I am going to pull back the curtain on the real medical science of peripheral nerve irritation. I am going to reveal exactly why conventional stretching and aggressive walking routines can sometimes make your nerve pain feel significantly worse, and I will walk you through the single most effective, doctor-approved seated exercise sequence you can perform safely at home in less than 3 minutes to decompress the neural pathway, boost microcirculation, and find immediate relief. Before we break down this life-altering seated reset, if you want to shield your physical independence, protect your feet, and maintain your mobility as you age, please click that subscribe button below and turn on the notification bell so you never miss another senior health masterclass here on the Dr. Robert channel. If you are ready to flush out leg stiffness and wake up your sleeping nerve endings with me today, please type 1 in the comment section right now. If not, drop a 0 so I can learn how to tailor these medical masterclasses better for your personal wellness goals. Let's look closely at the neurological architecture of your lower body. Your peripheral nervous system functions exactly like a complex grid of electrical cables stretching from your lower spine all the way down to the tips of your toes. These nerves do not travel through your legs in an open, empty space. They are threaded through narrow anatomical tunnels formed by your spinal discs, pelvic bone structures, deep hip flexors, and dense leg muscles. Furthermore, your nerves require 2 critical elements to survive and function correctly: a continuous supply of oxygen-rich blood, and the physical freedom to glide smoothly within their protective tissue sheaths when your limbs move. When you sit for prolonged periods, whether it is in a plush, sunken recliner, at a desk, during an extended church service, or on a long road trip, 2 highly damaging things happen simultaneously. 1. The pelvic inversion trap. Your pelvis tilts backward, compressing the lumbar nerve roots at the base of your spine and narrowing the muscular tunnels in your hips. This acts exactly like a heavy foot stepping firmly on a garden hose, slowing down the vital neurological signals traveling to your feet. 2. The stagnation of the second heart. Your calf muscles, which ye medically refer to as your second heart because they contract to pump stagnant fluid and blood against gravity back up to your chest, go completely silent. Without muscle contraction, microcirculation to your peripheral nerves drops, starving them of oxygen and causing them to misfire. This misfiring is exactly what you feel as burning, freezing, prickling, or that scary sensation that you are constantly walking on thick layers of cardboard or cotton balls. To reverse this structural trap, you do not need aggressive, high-impact movements that shock your joints. You need targeted, low-impact seated nerve gliding that clears the compression at the lower back, flushes out trapped fluid at the ankles, and reactivates the calf muscle pump without forcing you to stand up or risk losing your balance. let's break down the 5-part seated nerve wake-up sequence you can practice right from your chair. The core movement, the seated universal nerve glide. This is the #1 movement every senior over 60 dealing with foot numbness must master. It coordinates your lower spine, hip, knee, and ankle into one synchronized motion to gently slide the sciatic and tibial nerves back and forth through their tight tissue tunnels, freeing them from restrictions. How to do it? Sit near the front edge of a firm, stable chair. A dining room chair is ideal. Avoid soft couches that cause your spine to collapse. Stand your spine up tall, roll your shoulders back, and rest your hands firmly on the sides of the seat or on your thighs for structural support. Place both feet flat on the ground, hip-width apart, the stride. Extend your right leg slowly straight out in front of you until your knee is almost fully straight, but not locked out aggressively. As your foot extends, gently pull your toes back toward your shin while looking slightly up toward the ceiling. Hold this position for one brief second to introduce a mild, warm opening along the back of your leg. The decompression release. Now, slowly lower your toes toward the floor, while simultaneously letting your chin drop gently down toward your chest. This coordinated motion allows the nerve to glide upward toward your spine as it releases tension at your foot. Alternate this fluid, wave-like movement smoothly, toes up, toes down, head down, for 10 slow repetitions per leg. Move slowly enough that you feel your body guiding the pathway rather than pulling it like a tightrope. Step 2. The seated gas pedal activation. This targets your lower calves and ankles to immediately trigger the mechanical muscle pump, flushing out the pooled fluid that suffocates peripheral capillaries. How to do it? Keeping your posture perfectly upright. Return both feet flat beneath you. Keeping your heels firmly anchored to the floor, slowly pull your toes and the front of your feet as high up toward your shins as humanly possible. Feel the front shin muscles click on. Hold for 1 second. The routine. Smoothly drive the balls of your feet down to lift your heels up high, actively squeezing your calf muscles at the absolute apex for 1 full second. Alternate back and forth, toes up, heels up for 45 continuous seconds, followed by a 15-second rest. This direct activation immediately sends a surge of fresh, oxygenated blood flow into your lower limbs. Step 3. The seated knee march matrix. Poor lower limb nerve signaling frequently worsens when the deep hip flexors and upper thigh tissues go completely rigid, choking off the femoral and sciatic tracking lines at the pelvic junction. How to do it? Maintain your front seat position, ensuring your core is gently stabilized. Slowly elevate your right knee 2 to 4 inches off the ground, exactly like marching in place while remaining completely seated. The routine. Lower the right foot back down completely quietly. Place it on the floor with absolute control, without letting it slap down unguided. Alternate immediately to your left knee. Continue marching at a steady, relaxed pace for 30 to 45 seconds. Do not hold your breath and do not lean your upper body backward to force your leg upward. Let your core and thighs execute the alignment. Step 4. The dinner plate ankle articulation. Stiff ankle joints freeze the localized blood vessels, leading to cold, puffy feet that lose tactile feedback from the floor. How to do it? Extend your right foot slightly forward so your heel hovers an inch off the ground. Imagine your big toe is a pen and you are drawing a slow, perfectly smooth circle in the air about the size of a large dinner plate. The routine. Complete 8 wide, deliberate clockwise circles, then reverse for 8 counterclockwise circles. Place the foot down and replicate the exact sequence with your left leg. Do not rush into tiny, frantic circles. Maximize the full perimeter of your joint movement to unlock the tissue doorways between your ankle and foot. Step 5. The towel grip arched flex. This focuses entirely on the microscopic stabilizer muscles on the soles of your feet and arches, which are completely critical for preventing a lazy, dangerous shuffling gait. How to do it? Place a small hand towel flat on the floor in front of your chair. Rest your bare foot or socked foot on the fabric with your heel down. Spread your toes as wide as possible, then deliberately curl them inward to pull and scrunch the towel toward you. The routine: perform 10 to 15 slow scrunches per side. If you are sitting on thick carpet or don't have a towel, execute the raw version. Curl your toes tightly inward, hold for a second, then spread them wide for 20 seconds per side. This directly reconnects your brain to your feet, waking up balance confidence before you stand up. Running through this complete seated nerve wake-up sequence takes less than 4 minutes total. You can effortlessly integrate it into your life. Practice your nerve glides right after waking up before your first steps. Execute your ankle pumps during a television commercial break, or perform your seated marches right before standing up after an afternoon in your recliner. Let's speak with absolute transparency as medical professionals. These seated exercises are designed to break up long windows of stillness, decompress tight pathways, and boost immediate blood flow. They are not a medical cure for deep vascular disease and should never replace direct medical supervision if you are managing severe symptoms. Protecting your neuropathy requires conscious daily habits. Stay properly hydrated within your physician's parameters. Wear structured, non-binding shoes that don't compress your toes. Move your limbs gently every single hour, and inspect your feet daily for any scratches or skin changes. Doctor's essential safety note: if you experience a sudden, dramatic increase in severe swelling, localized redness, or intense heat in just one calf, or if you encounter sudden shortness of breath or chest discomfort, do not exercise. Stop immediately and seek emergency medical evaluation, as these can be signs of a serious deep vein vascular block. Your long-term physical freedom is not built out of random, exhausting gym workouts. It is constructed out of the safe, repeatable choices you repeat daily in your own home. By taking less than 4 minutes to glide your nerves, pump your calves, and wake up your toes before you stand up, you are giving your lower body the vital structural protection it needs to live life on your own terms. Please take a brief moment right now to comment below with your age and share which of these 5 seated habits you plan to try first during your next TV commercial break. Smash that like button, share this vital guide with a contemporary who is struggling with numb or burning feet, and subscribe to Dr. Robert to protect your longevity journey. Thank you so much for watching. Keep your nerve pathways clear daily, and I will see you in our next video.